Okay, guys. Here we have Andreas from
MAIER.
Germany.
Yep, we have Andreas MAIER from Germany, from near Stuttgart, and he is going to give us a presentation today about how he uses transdermal dosing of homeopathic medicines.
Okay, is there any introduction or shall I start?
Yeah, you go ahead and start. You're from Germany, you're a homeopath, and you're going to tell us about what you do.
Okay.
And then we'll have a question and answer time.
Okay.
As needed.
So I hope you can see my screen. Thank you, Sanjay, and thank you, Tika, for the invitation here to present my way of applying homeopathic remedy. My name is Andreas MAIER. I'm from Germany. I'm a homeopath with about 20 years of practice. And yeah, I want to show you my way of how I apply homeopathic remedies. And it's about the dermal application of the remedies. And I guess most of you, if not all of you, will be very critical when it comes to the dermal application of our remedies or of any remedy, and this for good reason. As Hahnemann himself, he cautioned against the use of it, and we will see what he had to say about it, because as we will see, he for a long time studied the action of the remedies when applied on the skin. And so I try to give you a little insight in his teachings from a very special point of view. So if there are any questions, feel free to ask, and you can just ask by speaking or use the chat box on the right hand. And if there are anything you want to know, or if something's not clear, so please feel free to ask. So first of all, wait. Yeah. Just to get started and to get the brain working, there's an introductory question I have for you. And it's just how long did Hahnemann devote himself to these external applications of homeopathic remedies? What we are talking about today is not the application of homeopathic ointments with combined remedies, for example, in the use of skin eruptions or inflamed joints, but it's about the application of the simillimum on the skin, okay? And Hahnemann himself, he studied the action of these applications for some time, and I just want you to guess. It's not a question which any even experienced homeopath should know. It's a kind of guesswork. So what do you guess, how long did Hahnemann devote himself to these kinds of applications of homeopathic remedies? Just make a guess. Just think about it and make a guess. Sorry, Tikva, I can't hear.
I think her microphone is off.
Yeah, somebody muted me. Hahnemann mentions that applications on whole skins that are whole skin and unaffected limbs is a completely acceptable method of dosing in the chronic diseases.
In the chronic diseases?
Yes.
Okay. So chronic diseases was written in the 1830s. So he'll have about 10 to 20 years of experience with these applications. Any other opinion? Dr. Sanjay, what do you think? It's really is guesswork. It's not really what any homeopath should know.
Actually, 5 to 10 years probably.
5 to 10 years only. Okay.
But then again, in the chronic diseases, he says that in venerate cases of genital warts, that you can even use thuja on the warts. We just went through that page today.
This is, yeah, exactly. Thank you. Very good, very good. In fact, he mentioned this kind of application in the Medicine of Experience, which was published in 1805. And he kept mentioning it until the 6th and last edition of the Organon back in 1842. So in fact, it was about 37 years of studying this form of application. I guess this is an interesting point, which is not in our minds as homeopaths. And in this course of time, he, as in other aspects too, he had to change his mind several times. And we will take a look at what he had to say about it. And as I said before, most, if not all, homeopaths are very critical when it comes to dermal applications of the remedies, and for good reasons. And I want to give 2 quotes on that topic. The first is from Herbert A. Roberts, and it is in his highly recommendable textbook on homeopathy. It's called The Principles and Art of Cure by Homeopathy. I hope you all know it. And he says there is only one condition where local application of the indicated potentized remedy may be used to advantage, and this is in cases where it is impossible to administer it by mouth. Okay, when we see the book was published in 1942, and when we study homeopathy, it's very important to see when these statements have been made.
Very important.
1942, very important. But as we'll see, and as you might have realized when you read the book, it is, even though it was published long time after the publishing of the 6th edition of the Organon, it's based on the 5th edition. And this is a very vital part when we talk about these kinds of applications. Okay? So the second one is about Hahnemann's view. And he says, the rubbing in of the remedy, it appears to favor the action of the medicines only in this way, that the friction makes the skin more sensitive and the living fibers thereby more capable of feeling, as it were, the medicinal power, and the communicating to the whole organism is health-affecting sensation. That is one point which is quite important and interesting, because in his books and in his writings, he always mentions the rubbing in of the remedy. I know some colleagues, they treat their patients by laying on of the remedy, or they give some of the medicine in the hand of the patient, and they should keep it for some minutes, or lay it under the pillow and in the night, and then sleep on this remedy. But Hahnemann himself, he repeatedly mentioned the rubbing in of these medicines. Okay, and as we think, we do not exactly know, but I guess we all think that homeopathy and the action of the remedy is based on a kind of energy. We usually would think, yeah, it doesn't matter if it's laid on or in which way it is applied to the body, but he repeatedly recommends the rubbing in of the remedy. So the next sentence, however, is even more important, because he says, homeopathy, however, hardly ever requires for its cures the rubbing in of any medication, of any, not only potentized or allopathic remedy, both medication, nor does it need any mercurial ointment. Okay.
No, it doesn't need mercurial ointment. Bad move.
Definitely not. And I guess this is what most homeopaths think. Sure, in his time, as we know, he left his practice and started his translations because of the widespread use of mercurial ointments and things like that.
And bloodletting and purging.
Bloodletting things, yeah.
Oh, yeah.
Exactly. Yeah,
Let's kill the
exactly.
patient. Mhm.
Yeah, exactly. And so here he says that there is no need to rub the remedy in. It's quite controversial to his other statements, as we will see. And here we have to look at the source of the quote. And there's a phone ringing. And this is from the 5th of the Organon, which was a highly controversial edition of this textbook. Okay, and this is the only source in homeopathy or in Hahnemannian literature where he cautions against the use of the remedies on the skin. Okay, we will soon see his other statements because he had to change his mind. Very short. That's surprising, after the publishing of the 5th edition, which is from 1833. Okay. So why do homeopaths not use the remedies locally on the skin? There are some reasons for that. Some are from Samuel Hahnemann, described in the Organon in the 5th and 6th edition. First of all, sure, we don't want to suppress external symptoms so that skin disease disappears and palpitations of the heart do come up. I guess we all have cases like that in our daily practice. Breathing difficulties like asthma and things like that coming up after the treatment, the successful treatment of skin eruptions or things like that. And we all have in mind that the local application of a remedy will lead to suppression in any kind. Okay, so this is one good reason why we should definitely think about what we are doing. Okay, the next vital point. Next vital point is, sorry, any questions? Okay, so the next vital point is that the local application of the remedy on the skin might remove symptoms, external symptoms, and they serve as indicators for the internal disturbance as a cause of the disease. So this is the next aspect which we should take care of. It's not about remove external signs and take away these indicators so that the next step will be very hard, as we cannot judge the disturbance of the vital force. Okay, this is also a statement of Hahnemann. And the third point why we don't use any homeopathic remedy on the skin is because most of us think it's only a local effect. Okay, but Hahnemann himself, he stated that, and I guess it should be clear for us that if we apply a remedy on the skin, especially if it is a dynamized remedy, then we have an effect on the whole organism. Okay, it's not just about treating local diseases and applying a remedy here. This would be a big failure. Okay, so this is not what we're talking about today. So now let's see what Hahnemann stated in his Chronic Diseases back in 1837. And Tikva, she rightly said that Hahnemann in the first volume, in the introduction to the chronic diseases, he stated that he uses the mother tincture of Thuja in the treatment of inveterate warts. Okay, parallel to the internal intake of the remedy.
Yes, it must be at the same time, so that we're not curing, because we don't want to cure the external symptom to destroy the external symptom when the internal disease still exists. And I'm sure you guys remember this from all the learning that we do in the groups.
Yeah, exactly. And he found in the treatment of old chronic warts, which did not disappear by the internal intake alone, that he had to put some tincture of Thuja on the warts so that they disappear. Okay, but this is also not what we are talking about today. And in his preface to the I guess it was the third volume of Chronic Diseases. It's not in the preface or in the introductory volume. The preface, which is called Concerning the Technical Part of Homeopathy from Chronic Diseases, and it was in 1837, just about 4 years after the publishing of the 5th edition of the Organon. And here he says if the same remedy that has been found useful is at the same time in its watery solution rubbed in, even in small quantities, into one or more parts of the body, then the curative effects are much increased, okay?
That's an important statement.
I think it's a really important statement.
Yeah, me too. That's why I'm refortifying what you said here.
Okay, thank you. Thus, the physician will receive a greater action from the medicine homeopathically suitable to the chronic patient and can cure him more quickly than by merely internally administering the remedy. Okay, this is for me the very vital point on which I build up my therapy. Okay, so what does he say? The same remedy which has been found useful. I guess we all agree it's the similimum. And this remedy should be at the same time in its watery solution rubbed in into one or more parts of the body. And he defines which parts he means. We'll come back to this later. And it's very important that the curative effects are much increased. Okay, he states that especially in chronic diseases, the action of the remedy or the speed of the cure, the progress of the cure can be much increased. Okay. So this is one very vital point of what I would say to you. And here we come to the dermal applications. This is what he had to say about it. It's just some points. He had to say a lot more about it. And let's look what he had to say. He said, dermal applications should be used on parts destitute of the causal epidermis. Okay. He found in his Medicine of Experience, as I said before, published in 1805, he found that the remedies do also work on the skin. He also mentioned in Medicine of Experience the smelling of the remedies and also a rectal application. And he also found the use of the remedies of the skin would be quite helpful. However, he also found that the skin would give a barrier to the action of the remedy. So he first stated that the remedies should be rubbed in on large areas, okay, or on parts where the layer of the skin is very thin. In the bends of the elbows or the bends of the knees, in the epigastrium, or in the, I don't know, yeah, don't matter, okay? Just where the skin is very thin. Okay, and he states that it will act upon the whole organism, as I said before. However, these kinds of applications are not useful in acute or chronic local disease. So we have, if we want to use the remedies on the skin, we have to think about what disease we want to treat, if it's a local disease or not. Okay, so we first have to read in the organon what Hahnemann understands of local diseases, what his definition is. We don't have to do this in this lecture, in this webinar, but I ask you to read it in the organon so that you know what Hahnemann understands of a local disease, and we should all be clear that we do not use remedies externally on the skin in local diseases. So not using the remedy on skin eruptions or on warts or on no matter joint affections and so on. Okay, this would be a failure. So this kind of application will speed up the cure, especially in chronic cases. Well, here in Germany, I don't know how the situation is in the country where you are from. In Germany, most of the patients who seek help from homeopaths, they come with chronic diseases. Okay, they come with chronic diseases. Background noises. Okay.
Yeah, somebody's got background noises going on.
Okay. So here is especially for the treatment of chronic cases. We might also use it in acute cases, but as we know, the administration of a homeopathic remedy in acute cases might help the patient or give an instant effect. We can see this in the treatment of children when we apply the remedy and the child is very anxious or is very restless and with lots of cough or things like that, and we administer the remedy, giving it orally as we usually do, and then we can watch the children or child becoming quiet, lying down, falling asleep, and so on, with an nearly instant effect. Okay, but how often do we see these effects in the treatment of chronic diseases? When do you ask your patients to call back or make an appointment for the follow-up? You just give some time, and you know the remedy takes some time for the action, and you wait for 2, 3, or 4 weeks before you make a second appointment. And then
I usually make my second appointment within a couple of days of the first dose.
Okay. Within how many days?
A couple of days at most.
Couple of days at most. Okay.
Because in my experience, I use water doses, and I have the patient check with me to see if their medicine is starting to work within a couple of days. And if it's not, then I wonder why.
Okay.
I don't do that watch and wait thing.
Okay. Well, I used to wait for about 3 or 4 weeks before I made up the second appointment or asked for a phone call. And so here in this local application, we will see, in lots of cases, a quite maybe an instant effect. And we will see what this effect is coming from. Because when we use remedies on the skin, there are many different effects that we have aside from the homeopathic remedy. Okay. So Hahnemann also recommended that the remedies should be rubbed in at the back, at the arms, or one arm, and at the lower limbs, on one thigh or one lower leg. Okay. So he found, obviously, that some localizations are more suitable for the external applications than others. And this is also, as I think, a very vital point, because we would think that it doesn't matter where to apply the remedy, as long as it comes in touch with the organism. Okay, especially when there is a potentized remedy. So, but obviously, it does matter. There are localizations where the remedy acts more beneficial than at other localizations. And we follow Hahnemann's rules for a very long time, but at one point we have to leave his instructions, and I want to explain to you later why we have to leave his teachings in this respect. So the remedies should not be used on parts subject to pain, spasm, or skin eruption. Okay, these should be left aside. But on the other hand, as we know, and we'll come back to this later, for example, in acupuncture or in trigger point therapy, we use painful spots on the surface of the body for treatment. Or when we think of acupuncture, when you press some points on the body, especially when they are very painful, then you will have a therapeutic effect. Okay, Hahnemann here, he cautions against the use of the remedy on these areas, but as experience has shown, especially on painful parts, it's not about having arnica, for example, rubbed in at a bruised part. You may do this, but it's not the point in the therapy which I use. But we should think about what makes or what is what is so special about a painful spot on the body. What makes this point, this very special point, painful? And I guess Hahnemann did not mean these painful spots, but pains or spasms in general. Okay, yet we don't know exactly. So in the forward of the chronic diseases, as I said before, Hahnemann mentions the arm as an option for the rubbing in, one arm, one thigh, or one lower leg. About 5 years later, in the last edition of the Organon, he also recommends the back of the body. And this is another vital point, because the back of the body is a very special localization. And it's my second question to you. I would ask you to think about it. What is so special about the back of the body as a localization for the rubbing in of the remedy? Is the question clear, I hope?
The nervous system, perhaps.
Nervous system, perhaps?
Yes. Because the spine's there.
Spine's there. Any other opinions?
The vagus nerve. I don't know.
Hahnemann actually put more emphasis on nerves.
Yeah.
Nerves.
Yeah, he
And,
talks a lot about the nerves traveling, right?
yeah.
Mhm.
So back the spinal column,
Yeah.
each actually there are sympathetic and parasympathetic nerves that
Yeah.
actually works throughout the body.
Yeah.
Yeah.
Absolutely. But
Yeah.
any other point? Yeah. Great. Thank you. Any other point which may come to our mind when we think about rubbing in a remedy on the back of the body?
No, somebody just typed in large skin area.
Sorry?
Somebody typed large skin area.
A large skin area. Yeah, it's, I have to see where I cannot see the chat. Okay.
We can also think one thing
Large
more.
skin area.
At least from the back, we can access the nerves more easily.
So it's a very broad area. Okay, thank you all for these answers. And it's sure it's close to the nervous system with the spinal cord, with the vagus nerve. But if we think about how do we apply, or how should we ourselves apply the remedy of the back of on the back of our body? Well, I guess
we need help.
we need help. So I guess I'm quite flexible, but you should apply a remedy between your shoulder blades. Yeah, I guess this for most of us is quite difficult, isn't it? What do you think? Could you, as a patient, if I asked you to rub the remedy in between your shoulder blades, what would you say?
I guess that I would have somebody put on a pair of rubber gloves and apply it for me.
Okay. Okay. But I guess we all agree that this is this cannot be done by the patient himself. So we have to think about how we could apply a remedy on the back of our body. And another point is at the back of our body, one is the nervous system, but there are also different reflex areas. Okay, the head zones and so on, which means we can affect each internal organ by treating the back of the body. Okay, so the back of the body serves as a great diagnostic field where you can touch and feel through our fingertips where there is tension or a little heat of the skin or a little coldness, and this might give diagnostic hints, or it might even serve as a great area for therapy. Okay. However, we as patients cannot apply these the remedies on the back of the body. And even though Hahnemann states in the foreword of the chronic diseases that he has years of experience with this kind of application, we do not find, or at least I did not find anything about that in his journals, in his case journals. Okay. So we do not know what he told his patients what to do. So, and when we think about maybe next week or tomorrow, you will go to your office and think, oh, it sounds pretty nice what Mr. Maier from Germany told us, and I'll tell my patients that they should use the remedy locally on the skin. So you have to make up your mind. You as a therapist will have to explain the patient, yeah, where should he rub the remedy in? Let's say a patient is coming to the clinic and complains of a headache on the left side, for example, the left temple, a headache, and he wants to have it treated by homeopathy. So you think, okay, I will try it with a dermal application. Where would you recommend the patient to rub the remedy in? After what we now have learned from Samuel Hahnemann, where would you rub the remedy in? Would you rub it to the right arm or to the left arm where the headache is? Or would you start rubbing it in at the lower leg or the thigh? On the right hand, on the left hand? So where would we start? So I see that.
Well, if you have a left-sided headache, then maybe you'd want to put on the right side of the body.
Okay, maybe.
Maybe.
on the
I'm just
right,
guessing.
Yeah.
You're here to tell us. I'm just guessing.
I cannot answer this question, but these questions must come up if we think about following Hahnemann's instructions.
Mhm.
He told us that we should change the area where the remedy is rubbed in. So we could start at the left lower leg, turn to the right lower leg, to the right thigh and right arm, and so clockwise. But we don't know how to do it. And I guess we have high expectations of our patients about how to take the remedy and what they should take care of. And so we should give as clear instructions as possible, okay? So that the patient will not leave our office and call us back when he's home and what should I do? Should I start rubbing it in, or should I first take it, then immediately rubbing it in? How many of the remedies should I rub in? And so on. So there are much questions left, which we should try to find some answers. Okay. So this is what Hahnemann he left us, and some things he's quite
Vague.
not that clear as we want him to be. Okay. So.
I think you are correlating homeopathy and acupuncture.
Sorry?
You are correlating homeopathy and acupuncture.
I will I will show you later what I'm doing. Yeah, but it's you're on the right you're in the right way. Okay.
Sir, one I have to say, I read a book of Jay Surya on acupuncture, who is China trained acupuncturist, and by profession he is a homeopath, and he mentioned all these points and he apply on acupuncturally acupuncture points of the disease he used, and he applied a homeopathic remedy, and he claimed that I got better results.
Yeah, there's a synthesis between acupuncture and homeopathy. Indeed, thank you very much, Dr. Satish. I will come back to this later because there is a link between homeopathy and acupuncture indeed. And this link was found by Dr. August Weihe, a German homeopath. I don't know if you have heard about him. Tikva, have you heard about Dr. Weihe?
No.
You did not hear about him? Dr. Sunute,
No.
Dr. Sanjay?
No.
No, did not hear about Dr. Weihe. Dr. Weihe, he was German physician. As we can see, he lived in the mid 19th century, and he investigated on painful spots and points on the surface of the body, and he found that most, if not all, diseases, be they acute or be they chronic, most diseases have as a concomitant symptom a painful and tender spot, one or more painful spot on the surface of the body. And so he investigated on these spots, and he found that some spots are linked to some homeopathic remedies. So there is if one point of the body gets painful, then this point might lead to pulsatilla, for example, or to lachesis or tuya. Okay, so he found there's a connection between these tender points and the disease, and on the other hand, there's a connection to homeopathic remedies. And later, a French acupuncturist, Dr. Roger de la Fouille, he found that lots of these so-called Weihe points, they were exactly located at the points of these known acupuncture points. And this is the link between acupuncture and homeopathy. And this is why some acupuncturists, they use or apply homeopathic remedies at acupuncture points. Okay, and they state that this therapy would be more effective than homeopathy alone. There are different ways of how to apply these remedies. Some use injections. The thank you for the hint, Dr. Vidyasagar. Dr. Weihe's father, he cured Clemens von Bönninghausen. Okay, it was not Dr. Weihe himself, but his father. He was the one who cured Bönninghausen from his tuberculosis. So I think this is how this kind of therapy is named. It's derived from homeopathy and sinology, which is Chinese studies of China, and this is the therapy which tries to combine homeopathy and acupuncture. However, what's the problem with this kind of therapy? If you use injections, you have to use combined remedies. Most remedies which are made for injections are combined remedies. And as I said, Roger de la Fouille, the French acupuncturist, he, for example, used lycopodium as a liver remedy on liver spots. Okay, so these acupuncturists, they use the traditional Chinese kind of diagnosis, and they have this Chinese perception of diseases, of physiology and pathology, which is totally different to our understanding in the Western world or in homeopathy. Okay, so this is why homeopaths they do not use these homeosymmetry, as they do not want to use combined remedies. They do not want to make injections, and they do not have this perception of Chinese medicine.
And in lots of countries, homeopaths are not allowed to do things like give people injections.
Yeah,
you know,
that's the other,
across America, Canada, here. I mean, that would be like, you know, we're not supposed to do that. In America, you're not even supposed to touch a patient. Okay. Which is, you know, virtually impossible because, you know, it's like stick out your tongue, we need to see, right? But, you know, they have these things in place where people are overstepping their treatment boundaries according to legal things. So using injections in a lot of countries would be a real problem, you know, and harder to pass off than, you know, that's touch your leg and see your wound,
Yeah,
which we
okay.
have to do anyway, right?
Okay, this is a very important part. Yeah.
I don't know what the laws are in India for that. Are people allowed to do injections? Homeopaths?
No. No.
No injections. Okay. So another important statement in the chat that Hahnemann clearly mentioned in Organon of Medicine that acupuncture one of the counter-irritant treatment. I'll come back to this later, but I'm very thankful for this statement. I have this this part of the Organon here later, and I'll explain what it's about. Okay. So back to the presentation. So Weihe, he even was able to produce painful spots in remedy provings. Okay, so as I said before, there's some points which might indicate pulsatilla as a remedy, and so he proved some remedies, and he found that in the course of this proving, some painful spots on the surface of the skin appeared. Okay, and here we see this acupuncture meridian, which is given in red. The meridian, so-called meridian, it's a pathway, an energetic pathway where the vital force flows. Chinese, Dikva, you might know this or remember it from your acupuncture school, that the energy flows. The Chinese, in Chinese medicine, the perception is that the energy flows in certain pathways. And here, right beside the spine, there is the bladder meridian, and some points on this bladder meridian, they get when they get painful, sorry, they indicate that an internal organ is disturbed. There's a disturbed organ function. For example, when bladder 16, an acupuncture point is painful, it might indicate the liver, for example. Okay, so this is for Dr. Weihe. This was a diagnostic.
Can you type his name for us? I'm sorry. Can you type his name so we can write it down?
Sorry, let's go back. It's on the top, Dr. Weihe, the Weihe points. August Weihe.
Okay, hang on. Gosh, no, I don't have a pencil. I need to write this down for further reference.
Doctor.
Yeah, as I heard, there is not
Hello.
much literature, for example, in the US or English literature about the findings of August Weihe, which is
Yeah, this is a new name to me.
okay.
Okay, continue. Sorry, guys.
Which way we have to... Hello.
Yeah.
नहीं, होम्योपैथिक डायग्नोसिस हमको होम्योपैथी से करना चाहिए फिर या एक्यूपंक्चर से करना चाहिए?
Sorry, did not understand you.
अगर आप डॉक्टर संजय
Translate.
Sorry.
नाही आपल्याला जर ॲक्युपंक्चर पॉइंट वरती होमिओपॅथीची मेडिसिन हे करायची तर आपण म्हणजे ॲक्युपंक्चरिस्ट पद्धतीनं डायग्नोसिस करायचं का होमिओपॅथीच्या पद्धतीनं ती केस घेऊन ती रेमेडी काढायची? How we choose the remedy is on the basis of acupuncture or the basis of homeopathy?
No, sorry, now got you. Sorry for that. I choose the remedy according to Hahnemanns rules, which means I try to choose the simillimum. I make the anamnesis as Hahnemann told us, and then I make the examination of the patient, and then I administer the remedy. But the remedy is chosen according to classical principles, which means by repertorization and all the things. Okay, so we have to definitely make the anamnesis as Hahnemann he told us. Okay. Okay. So
then how you
found,
choose the point? How you choose the point to apply that remedy?
Yeah, this is a very special question. I try to answer it later. Okay. I'll come back to this question later.
Okay. No problem. No problem.
No problem. Thank you. So what Weihe found is that these points on the body, they can be referred to certain homeopathic remedies. And it's interesting that if there's, as I said before, some points in acupuncture are called alarm points, because when they are painful, they indicate an internal disturbance, especially in a certain internal organ. And Weihe was able to refer remedies to these points, and often not only the localization of the points was like the acupuncture points, but also the action of the homeopathic remedy was similar to the action of the acupuncture point. There are some similarities between homeopathy and acupuncture. Some points have a very specific action. Some have a very wide range of action, similar to our polycrests or to our small remedies. Okay, and so not only the localization of the points was similar from the Weihe points with acupuncture points, but also the action of the remedies.
Yeah, can I just say something here?
Yeah.
We'll see here with this chart you have here that you'll see that there are, in the repertory, in the proving data, that there are points that this indicates in the proving data that there will be a pain here or a pain here, just like it is on this chart. Does that make sense? As we go through the proving data, we will see things like, chelidonium has this pain here on the back. You know what I'm saying? So this adds up.
Yeah.
This makes sense.
This makes sense. Absolutely.
Yes. Yeah. Because those referred pains make sense and they're in the proving data. Okay. Yeah.
Okay. However, in our classical materia medica, there are only few painful spots mentioned. Okay. So all our materia medica, especially from Hahnemann, is not very specific when it comes to the description of localizations. Okay. In the upper abdomen, this could be quite an area. It's not that specific as it
because you're looking at pinpoints as opposed to regions.
Sorry?
Because you're looking at pinpoints as opposed to regions.
Exactly. So Weihe points are the small points, not these areas. Okay. So here is another statement from a German physician. Nature does not know any one-way streets, so trigger or acupuncture points are all the same at the same time places for diagnosis as well as therapy. So this is what I said before. Hahnemann, he thought that we should not rub the remedy in at painful areas, However, as we know from trigger point therapy or acupressure or acupuncture, especially painful spots can serve as points for therapy. And the stimulation of these points often have an effect. Okay, so what we do when we do trigger point therapy, we look for